zygoma, we're not going to go into the foramen because the foramen is under the zygomatic arch. Injections today are going to be done with the needle. People saying you cannot use a needle here because you have to use a cannula because it's safer. If you know what you're doing, you can use a needle. It's much more precise than a cannula. Following on from me, we're going to see the same sort of treatment done with the cannula, and you can take your pick depending on your skill. I use both, but generally speaking, for this technique, I'm going to use a needle. Patient is in up gaze. I've already marked out the areas that I want to treat. Patient is in up gaze. My non-injecting finger is protecting the orbital rim. I know exactly, having done a push test. Let me just show you that, show you that push test. I did a push test to see where I want point of maximum fill. That's where I want the filler to sit, so that's where I'm aiming. Look towards me, look up to the ceiling. Non-injecting finger on the orbital rim. 3, 2, 1, deep breath.
Tyra, what kind of product are you using?
So I'm using a product called Redensity 2. It's made by Tioxan. It is 15 milligrams of HA, mixture of cross-linked and non-cross-linked. It's minimally hygroscopic, and there was some mention earlier on about having products that don't swell. All sensible things to think about when you're choosing a product for the under eye area. Sit up for me. So every injection point, I'll ask the patient to sit up because that is the best way to assess. Look up to the ceiling. Can you see the change in the defect of the under eye?
Yes, how much volume was that?
0.1. So 0.1 of the right filler in the right place, because we don't want to put a lot of volume in this area for all the reasons you've heard. But if you do the right product in the right place, look straight ahead for me, you can already see we've taken the depth of the tear trough out with 0.1 of a 15 milligrams per mil of HA, all the way back for me. So that was the medial part of medial soothe. We are now going to go, so remember medial soothe sits from the mid-pupillary line to the lateral canthus. It's a bit of a misnomer because you think medial soothe is something medial of the face, but it's medial compared to lateral soothe, mid-pupillary to lateral canthus. So that's the medial part of medial soothe. We're now going to go to this point here, which is the lateral part of medial soothe. That's where I want my correction. This is where I'm going to enter. 3, 2, 1, deep breath. Well done. I'm just going to ask you, Lynn, on a scale of 1 to 10, in terms of discomfort, how painful was that? Okay, so she's had no local anaesthetic on her skin, she's had no topical local anaesthetic, she's not had any lidocaine in the area. This is actually, when done properly, a virtually painless treatment. She's nodding. I'll pay you later. She's nodding because we're going into a space, so we're not getting any stretching of the tissue. The needle is sharp, and it's a 30 gauge needle. Sit up for me. And you can see what we're doing. We're just working our way along. So, we've done medial aspect of medial soothe, lateral aspect of medial soothe. We're coming up to lateral soothe. Okay, so again, I'm just doing a push test. I want to actually lift her from here. But what I might actually do before I do lateral soothe, I would quite like to lift her lateral canthus. Lifting the lateral canthus will stretch this loose skin if we get it in the right plane. So remember, this is what a lot of people would refer to as a festoon. A lot of people would look at that and think it's fluid. You know it's not fluid because when you do this, it flattens. There's no bulge and there's no distortion of the fluid with, edema. When we've got pitting edema or edema on the skin, you stick your thumb in it, it leaves a dip. This is not edema, it's just loose skin. Okay, so if we stretch and support it, obviously surgically would be the nicest way to stretch it, but if we stretch and support it by putting some support under the muscle here, she will look better. So I want to do this. Obviously, we're not going to do that because that's surgery, but that's in effect what I'm trying to create. So we're going to go to the lateral canthus deep to the muscle, tip of the needle, so the bevel of my needle is down. Deep breath. I'm on bone. I'm just going to tap my way forward till I'm just under the ligament. My non-injecting finger is on the orbital rim. And I'm just putting about 0.1. So can you see the product is a little bit bumped there, and it's very tight under the skin. If this were any other product, you'd be going, oh my goodness, look at that bump, I'm really scared. But this is Redensity 2, it's a beautiful product. I'm literally going to give it the tiniest bit of firm pressure, and it's flat. And it's flat under the muscle, supporting the muscle, stretching the ligament. Let's sit her up and see how it looks.
Tara, could you wipe the markings so that we can see the result?
Yes, I will do that. Thank you, Ro.
So you mentioned you sometimes use a cannula or needle technique. Is there anything in particular that makes you decide which technique you're going to use?
Speed. So needles are quick, they're precise. If you know what they're doing, they're safe. So we've got, can you see that the corner of her eye is lifted?
Yes, you can see the shortened.
Right, so this is a true non-surgical outer canthal lift delivered by a needle and 0.1 of a mil of product. Okay, so we're almost there. I still want to get some correction in lateral sheath here. All the way back. So we can see that dip, and don't like how that's catching my eye. I want to get some support under there. Deep breath. So I just felt that needle drag a little. I might, on this point, change my needle on the next. It's a beautifully moldable product.
So you've done 0.4, correct?
I have done, actually, believe it or not, 0.35. Somewhere along the line I was a bit conservative. Yeah, just getting a needle change. Sit up for me. So plenty to do both sides in one. I'm hoping you can, that correction from where I'm stood here looks great. I'm hoping you can see that too.
Yes, we can definitely see. Can we see the profile as well, Tara, please? Looks beautiful.
And what's very useful is creating a smooth transition between the cheek and the lateral canthus. To me, that is the single most youthful look you can give somebody. You know, when I do mothers of brides and lots of photographs taken from the side of the face at weddings, giving them this is just, it's just such a pleasure to do that because they've got this beautifully smooth transition. Okay. She's still, you can see I constantly do this because it shows where the give in the skin is. Okay, she's still got a tiny bit of gap here all the way back, and that is just medial aspect of lateral sooth. Sorry, lateral aspect of medial sooth even.
So Tara, your patient has very good anterior cheek volume. If your patient had a neutral or negative vector, would you use the volumizer there as well?
Do you know, I actually have RHA4 already on my trolley here, believe it or not. There's my volumizer ready, can you see? Because I was going to, but because we were time short, I thought let me just, and she does have some anterior, just very nice anterior volume. I'm gonna do that. If I've got time, I'll just put some in her deep medial fat compartment just to complete her curve. She's got good curve here, but she's got a bit of deficit here.
Is there a recommended amount that you would use on each side?
What, of
Maximum
Redensity 2 for the tear trough or for
in general, HA on each
So,
side?
do you know, if somebody comes for first filler and they, I tend not in my practice to do individual indications. I try very much to do full face rejuvenation. I did actually promise this lady for full face rejuvenation. So as soon as we're finished here, I'm going to whip her around the side, I'm going to finish her face. And I say a syringe for every decade of life. So this lady's in her 50s, she's going to have 5 syringes. We're going to do some in her mid-face, some in her jawline, some in her cheek. Sit up for me. Some in her labia mental.
But for the under eye area, you
Oh,
would
for the
stay-
under eye area, 0.5 ml each eye with the Redensity 2 and probably 0.5 ml each side for the RHA4 in someone with this good volume. That's the shape of things to come. That's where she's really going to need everything to balance her face. If you just do a cheek, she's going to look top heavy at the end of it.
And if you could wipe the markings, please, on the opposite side, I think
I
we'll be
will
able
do
to
that.
appreciate the result.
The reason I did that was because I wanted to show you that if you want to avoid zygomatic facial, that's the lateral part of the orbital rim. Remember, if you draw in your tear trough and you draw in the separation of the malar fat pad, it gives you a really nice guide as to where you to put that first injection point. But yes, let me wipe that off so you can see what it's done. I'm so sorry. The wiping hurts more than the needle because I just poked her in the eye. Okay, there we go.
And
Can
can we
you
see her
see
a
the-
little bit with the chin down as well?
Little bit.
Yeah, perfect.
There we go.
And that's a beautiful result with.
With 0.5 of a mil of Regency 2. How are we doing for time, Ron?
So you have just over a minute left. What aftercare instructions would you give your patient?
Don't fiddle with it. We usually put a little bit of anti-inflammatory sun protection on their skin when they leave, and I say they can wash their face normally that night, and tomorrow you're back to normal.
Amazing. Well, beautiful result there, Tyra.
Okay.
Tara, can you tell us,
Yeah.
are you using any energy-based devices or
So
lights or lasers
interestingly,
or
so my practice is based in the middle of the UK, where everybody wants to spend 50 pence and it has to last them 3 years. I'm not allowed to bruise them. Their husbands can't find out. This is the nature of my practice. And energy-based devices in my clinic, where I work in Leicestershire, if a patient has 500 pence to spend, they have to get instant and impressive results with that money. And I can't give them 16 syringes, I have to do it in 2 syringes. Right? I have to do it in limited product. That's why these are the techniques I use. If I put an energy-based device, they have to have 3 treatments, 6 months apart, and good before and after pictures to convince them that it did. I don't have to give them good before and after pictures to convince them that this has done the job. So in answer to your question, not much in the way of energy-based devices, because if you can do that with 1 syringe of product, why would you need it?
Thank you very much, Tara. So we're going to leave you to treat the other side of your patient, and we're
Thank
going to
you.
move to Dr.